Hello friends, I'm Dr. Poonam Sambhaji. I'm going live after a long time and I'm planning to go live maybe twice a week. I have not decided the time. I'll be deciding the time in trial. And I wanted to tell about something that happened in my clinic today. Okay, so what happens is on a daily basis. Most of you know, whoever is new here. Okay, let me introduce. I'm Dr. Poonam Sambhaji. I'm a child and newborn specialist from Goa, and on a daily basis, I encounter different parents, and some stories I want to share with you all. Certain mistakes that you as a parent should not do, or you should learn from someone else's mistake. Why? Because life is too short to do all the mistakes in one life, right? Yeah. So today what happened is, for the first time, sound distance of maybe 20 kilometers away from my clinic, and as they were coming, the baby had fever. Okay, so since the baby had fever, the parents were getting the baby to me to get the child seen and do the treatment for the same. As the patients were coming from their area, they crossed to the area of Mapsa and then Porvorim. And here in Goa, in Mapsa Porvorim, there is a huge lot of traffic jam, especially in the evening time, because of the construction of the new roadways and the new flyovers which are going on. Okay, so in this transit, the baby's temperature went on increasing. Certain mistakes that the parents had done was, the baby was wearing a thick clothes. Okay, they are wearing thick t-shirt, full handed, with full hands, then thick pants. Okay, plus the baby wasn't given a fever medicine because of the fever. Multiple times parents do this mistake. They feel, नहीं हम डॉक्टर के पास जाएंगे, डॉक्टर चेक करेंगे, उसके बाद बताएंगे क्या करना है. Fever management is in your hands, friends. Why? Because baby can get something known as typical febrile seizure. A baby who is below 5 years of age and above around 6 to 7 months of age, when they have very high fever, they can have typical febrile seizure in which the baby starts throwing fits. Okay, they start becoming stiff, their eyeballs roll up, they become unconscious, they will start moving their hands. Okay, these sort of things can happen. And to avoid this thing, first is see that you follow six principles of fever management. Now, what are the six principles of fever management? First is check the temperature. Always have a thermometer with you and check the temperature. Second is give the fever medicine to the baby. Multiple times, as I said, parents do this mistake. They will say, नहीं डॉक्टर के पास जाऊंगा उसके बाद fever medicine दूंगा. No, please give it. We will understand that you have taken the temperature, you are telling us the temperature, so we will understand that you have given the medicine, right? The records can be kept. Then wipe the baby top to toe with normal tap water. Just wet your hands with water and wipe the baby top to toe. Third, see that the baby is kept with minimal clothes. Like small babies, you can keep them with simple sandals, banyan chaddi dalo, enough. Okay. Fourth, see that the room is well ventilated. रूम में फैन होना चाहिए, थोड़ा एसी है तो एसी, नहीं तो कूलर है तो कूलर, but see that the baby is kept warm, where the baby is kept cool and with less clothes when the baby is having sickness. Okay, and then very important, see that the baby is kept hydrated. उसको पीने के लिए बहुत दे दो. खाना नहीं चाहता baby when baby is sick. Okay, if baby is sick, खाएगा नहीं. So switch your mentality to drinking. Okay, now what happened to this case? As the baby was coming, thank God, through the traffic कुछ नहीं हुआ. But as the baby came near my clinic, and the father just parked the car near my clinic, the baby threw a seizure, and the frantic mother just ran with the baby inside my clinic. And I had just finished some of my patients, and I was sitting when I saw someone just opening the door and coming inside my consultation. I'm like, what happened? It's like, doctor, look at him, what is he doing? He's unconscious, he's all gone bizarre. Okay, I said, don't worry, cool down. Kept the baby on the table, on the examination table. Gave immediately, I saw that the baby was having fever. Immediately took a suppository of fever. I pushed the suppository inside the anus of the baby. That's what we do for the fever management. Okay, in such conditions, because baby is unconscious, You cannot put something in the baby's mouth when the baby is unconscious. Okay, you can give injections, but this happened in a OPD setup wherein we usually don't try to give injections of fever and what is that, seizure medications. Okay, so what I did was I controlled the fever. I gave the fever medicine. I just took the water, put my hands in, and started wiping along with my nurse. We both started wiping the baby, and within around 30 seconds or 1 minute, the baby cooled down. Okay, the baby cooled down. She was still coming back to consciousness. The mother was all scared. Father was super scared. He was going on saying, he was going on taking God's name. Okay, he was super scared because this happened for the first time. On top of that, this was their first visit to me. They were all like scared. First of all, they came searching for my clinic, and exactly when they reached the clinic, this thing happened. So I was just praying to God. I'm like, thank God, this thing didn't happen in the middle of the traffic where the father would have gone, God knows, gone so bizarre and so confused he would have been. Okay. So we controlled the fever, we controlled the seizure, and I told them their mistakes, that they were overclothing the baby. They had not given the fever medicine to the baby. Should not do this in next time. And since it is a typical febrile seizure, I was taking the history where the parents have the history of similar cases. Remember, friends, whoever is watching me, whoever is having small babies, if you have small babies, watch this case, watch this video. If you don't have small babies, please send this video to someone who has babies who are less than 5 years of age. So remember, whenever there is a baby who is less than 5 years of age and they have fever, you have to follow the 6 steps of fever management, which I already told you. Go back few minutes back and you will see that. Okay, once this video is uploaded. Secondly, never do the mistake of not checking the temperature at home. Okay, and then getting the baby with high fever to the doctor's clinic. They will maybe has throw a seizure because baby's brain is not very much developed. So small things, they can throw a seizure, they can go unconscious. Okay, so then this baby we control. After some time, I made her sit in the waiting room, and we still told her to control till the temperature came down. Meanwhile, since I'm a doctor who has only a clinic setup, I don't have an admission facility with me. I immediately called the doctors who had the admission facility. Because this baby was stable now, I told them that I'm sending the baby to them. I wrote the note regarding the medications that I had given, the cooling measures that we had given. We gave him a medicine for the so that the seizures don't repeat again. We gave him a medicine dose, calculated the medicine dose, and then we gave it to him. And then after around half an hour or so, this baby was sent to the hospital for admission. Now the baby is safely admitted in the hospital. One more mistake that the patient was by mistake going to do while giving the medicine, the medicine for the seizure, to avoid the seizure, that I had given to the baby, I wrote the dose 1.5 milligram. So I 1.5 ml. Okay, so I told the mother, you have to take 1.5 ml and then give it to the baby. Okay, what the mother did is, there is a small syringe inside the medicine pack. Okay, she took the medicine pack, syringe, and she removed the whole medicine. And they're like, "Itna medicine?" Then she was like a little bit confused. Till then, we just happened to notice. I said, no, not this much. Okay, and I told her, show me the dose that you're giving, but then she forgot. Okay, then immediately we happened to see. I said, no, not this much. I removed. She had almost filled 10 ml of the fever of that seizure medicine, which is not at all her dose, was 1.5 ml. So we threw out the rest of the medicine. I mean, threw back into the bottle. We just took the 1.5 ml. I told her, now give it to her, the baby. Okay. Baby was given the fever medicine, cooling measures done, the anti-epileptic medicine was given. Baby was stabilized. Both parents were stabilized. They were cooled down. Mentally, they were little bit at ease. Then I said, now is the time for you to go to the next hospital where the patient will be admitted. As soon as you get the baby admitted, please just send me a text message, baby is admitted. So that happened at around 9 o'clock. I got a message that, doctor, we are admitted. And I just told him, you were lucky enough, things happened right in front of the clinic rather than happening in the traffic. But some other parent may not be that lucky, right? So that's why send this video to all those parents whose babies are just maybe 5 years or below, so that they know what is typical febrile seizure, how to manage the fever whenever there is a fever, and how to see that the baby's temperature comes in control, and also do not do any mistakes in the dosages of medicine. Bye bye. Thanks for watching this. I know there are only few people presently because today is the first time I'm doing live. But yes, I'll be coming live very often, and I want to share the stories that happen in the clinic so that you all know certain new things that you can also practice and can share with other parents too. Bye bye.